Now, as I mentioned, this is a great European success story. You know, Europe is the birthplace of universal health coverage, going all the way back to Bismarck in the 19th century. Admittedly, back then, the idea was it wasn't truly universal health coverage. It was to have a healthy male workforce to run factories and fight wars. And you know, it was very much a sort of a national security issue as much as anything. But then we've seen the transition to truly universal health reforms, the UK being a very good example. At the end of the Second World War, when emerging from the Second World War, the Labour government introduced the welfare state, of which the National Health Service is one of the sort of the crown jewels. And this is Nye Bevan, the architect of our UHC system, actually at its launch, 5th of July 1948, in a hospital in Manchester. It's almost like biblical, this picture of him sort of, you know, with the young girl in a hospital, a very, very famous photo. And we're all extremely proud of our NHS. But I think now we're sort of seeing in this day and age that, you know, there are obviously huge challenges that we're facing, and political leaders across the world are coming under tremendous pressure to sort their health systems out, to make sure that everyone gets the health services they need. And I think that through this crisis, we're going to be seeing some, you know, the making or breaking of leaders. Some leaders are stepping up and sort of really authoritatively sort of providing good advice and support and tackling it. And then, of course, you've got the likes of Donald Trump, you know, that seems to be doing his best to sort of completely undermine public health measures and in many respects take the United States away from universal health coverage. So might it be the case that COVID-19 is a catalyst for UHC? Because, you know, what we see is that this crisis requires immediate action from the heads of state, particularly around access to health services and financial protection. And those two things together really are universal health coverage. And there is an expectation that these entitlements are universal. Everyone realizes it's ridiculous that you have sectors in society that might not be being tested, that might not be accessing services, because, you know, that threatens everyone's health. And also people want to see results quickly, you know, that people are frightened, you know, they want to get the health services, they want to see immediate action from their leaders. So thinking about this as worldwide, not just in Europe or the United States, but sub-Saharan Africa and Asia and all over the world, what is it that leaders need to be doing? And I would suggest, you know, that they're largely along these lines, that we need to have reforms that are truly universal in nature, providing a full range of services, public health services, right the way through palliative care. That you get your best value for money, particularly in cost-effective primary healthcare services, particularly in the sort of the testing and the community services, which sadly the UK has performed very badly in so far. But that's due to the inept political leadership that we have in our country at the moment. And of course, that we need to be sort of looking at full systems reforms, human resources, essential medicines, infrastructure. If you're going to sort your health system out, you need to tackle all the separate elements that make up a health system. But the only way that you're going to do that is through public financing. Any idea that you're going to expect people to pay for these services out of their pocket is completely, you know, mistaken. You have to publicly finance your health system. And especially, and it's very interesting, you're seeing these trends at the moment, get rid of financial barriers. User fees in an era of COVID-19 are a wretched idea. And you're even seeing in the United States measures to try and ensure that COVID tests are available free of charge. But given the complexities of the US health system with reimbursements, that's not really happening at the moment. And I'd just like to sort of, you know, illustrate, you know, in finishing off some great examples of, you know, where this has happened. And in fact, where I'm actually quite optimistic that this COVID-19 crisis is going to trigger more UHC reforms around the world. Sri Lanka, for example, in the Indian Ocean, it launched its UHC reforms coming out of a terrible malaria epidemic, actually in the 1930s, which brought about radical political changes and the population demanding that everyone be protected in future. So it's a very real example of a successful UHC system, and Sri Lanka is actually coping pretty well with this pandemic so far, you know, sort of all these years on. Thailand, in 2001, just after the financial crisis, Thaksin was elected prime minister. The country was bankrupt after this Asian financial crisis, and he announced to the population he was going to introduce a universal publicly financed health system. The World Bank said he couldn't afford to do it, and he just went ahead and did it anyway. And it's been spectacularly successful. And in this pandemic, Thailand has recorded 56 deaths, that's all. And I don't think there was a single new case yesterday. So everyone's looking to South Korea, another very successful UHC system, but Thailand as well is performing spectacularly well due to these reforms introduced by the Prime Minister. And there are many other examples. Well, Indonesia, this is the then governor of Jakarta, the capital, who introduced a universal health scheme back in 2012, within a month of coming to power. And it was then in the presidential debate on television, having seen the success of this, that he announced to the population that he was going to bring universal health coverage to all Indonesians. Now, if the truth be known, he hasn't really succeeded in doing that yet. And Indonesia is not spending enough money, only about 1.3% of GDP. So if Jokowi's smart, I would suggest he should be doing what Thailand did and really going fully universal through this crisis. And you have situations now that world leaders are talking to each other about this. This is the former chair of a group called the Elders, a group that we work with quite closely, Kofi Annan, talking to Jokowi only about 3 or 4 years ago about the merits of scaling up UHC reforms, very much emphasizing the political benefits to him in doing this, you know, saying, look, if you want to be a great leader, you need to have a truly universal health system. And this is quite a lot of the work that we do at Chatham House to try and sort of catalyze discussions like this between successful world leaders to advise up and coming leaders about the merits of universal health coverage reforms. Other interesting countries that for many years, the world's biggest democracy, India, access to healthcare wasn't really a big political issue, but Prime Minister Modi is sort of, you know, a wily politician and sort of recognizes that access to healthcare should improve in India. But his reforms are very much a hospital insurance system, in many respects quite similar to the US. And India isn't doing well at all. It's a low spender, and huge swathes of the population don't get access to healthcare. But then politically, it's quite interesting because you have some of the states now in India that are adopting more of a universal health coverage approach. And this is in the center of the photo here is the chief minister of Delhi state, again, the capital, just like Jokowi in Indonesia, now providing universal free health services through Mahala clinics, neighborhood clinics. And we took the elders there, this is Ban Ki-moon and Gro Brundtland, in 2018, to look at this and suggest that this would be actually a better model for India to follow than the Modi care reforms. And I think it's true to say that Prime Minister Modi wasn't very impressed with this intervention. But, you know, these are the debates that need to be had in countries like this. And this is a much more recent tweet, actually, from the Chief Minister, very much adopting a South Korean approach of sort of testing and contact tracing, very different approach to Modi. So huge battles being fought out around the COVID-19 response within India, and it's going to be very interesting to see what happens next. South Africa is another country where it's has had a very fragmented health system. The rich get access to healthcare, mostly the white population, through very inequitable private insurance schemes. But for years, the poor black population had a very underfunded public system. And now President Ramaphosa, having taken over from Zuma just last year, is very much focusing on health and is doing extremely well in this COVID crisis. You know, he's acted quickly. Here he is in his battle fatigues, you know, sort of taking on the, you know, the COVID. But there's a very good chance, I think, that we're going to see dramatic UHC reforms coming now in South Africa, a country we're actually heavily involved with. I was actually in South Africa with the president's office the very first day that the first case was detected in South Africa. And I'm absolutely convinced they're going to use this crisis to create a UHC, you know, a European-style health financing system. And just to finish with, you know, I think the most intriguing one, the United States. Obama did a very good job, I think, going as far as he could politically in making health insurance mandatory. You know, it went to the Supreme Court, got through. Now, Trump has obviously tried everything he can to blow this up and undermine it. But the Republicans have got no health plan whatsoever and are very badly exposed on this. And you're seeing within the Democratic Party a huge move now to be much bolder, you know, calling for Medicare for all. You have sort of 4 presidential candidates saying, unfortunately, they've all dropped out now. Of course, you know, sort of Joe Biden's the candidate. But only yesterday, Bernie Sanders calling for a vaccine in the United States to be made universally free for everyone. And you're seeing it again in some states in the United States, some governors moving much faster. This is the governor of California, who swept to power, largely backed by the health workers, and in particular the nurses, promising to bring universal health coverage to California. And it's very interesting, in the California health reforms, they are providing universal coverage even for undocumented migrants, which is sending, you know, the likes of Fox News bananas. You know, that, you know, someone should be thinking of covering illegal immigrants in the United States. So, just to conclude, I think, you know, that yes, COVID-19 is this biggest threat we've had in over a century, and is something, you know, very fearful. But at this time, people are looking to their leaders for salvation, really, and saving from the virus, saving from a financial ruin. This is therefore the perfect time to be pitching to political leaders that, as well as tackling the existing crisis, they can emerge from this as great leaders. So many of the world's UHC reforms have come out of crises, not least in Europe, where so many of the UHC reforms came at the end of the Second World War. I think that therefore we as Europeans really should be getting out there to encourage these countries, South Africa, India, Indonesia, to introduce universal health systems, and even encourage the Americans to join the rest of the civilized world with a universal health system. Thanks very much indeed. Thank you.